welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Cathy Woodhouse. She is an internal medicine pediatrics physician, and she wrote the Kevin MD article, Amid Powerlessness, Reclaim Your Personal Power. Cathy, welcome to the show.
Thank you, Kevin, for having me. This is fantastic.
We'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
I am a med-peds trained physician in clinical practice for over 20 years, and I'm also a certified coach, an author, inventor, and entrepreneur, speaker. And Kevin, I've had kind of an atypical career. I didn't have money for medical school, so I enlisted. I became a commissioned corps officer in the public health service. So after residency, I traveled all around the country for 8 years, providing care to medically underserved populations. And it was meaningful work, great work. But at the end of my obligation, I burned out from overwork. I couldn't work. And it was so bad that I had to move back home at the age of 38 years old to live with my mom and dad. Took me a couple of months to recover. And when I did, I decided to do part-time locums work at one of the large area hospitals as an internist exclusively. And working part-time, something happened, which was wonderful. I found myself again. I had time to think and rediscover the person who I was before the burnout started. I lost 40 pounds. I wrote a book. I co-invented a device for medical wheelchair users. I got a 3rd board certification in obesity medicine. Kevin, when physicians and clinicians have time and space, we can do stuff. And I discovered that when I was traveling around as a locums doc, I would visit the same offices again and again. And I noticed that my brilliant, fantastic women colleagues were suffering from burnout too. So I started training to become a speaker because I was going to get on the stage and encourage them and strengthen them. And then COVID hit. Then COVID hit is probably like a through line for a lot of the people that you interview, I'm sure. But I covered 7 colleagues, 87% of whom were African-American women, just like me. And out of those 7 colleagues that I covered for, while they were sick with COVID, 6 got very sick, and 1, the 7th, ended up on a ventilator and died. And that's when I made the decision not to be patient-facing during COVID. But I decided to launch my business. So now I help stressed out, burning out women physicians get the clarity and power they need to make the work that they want. And I cannot wait to speak to you about power.
You mentioned that you felt burnt out and then you switched and made a little bit of a transition in your career. What specifically were you feeling that made you realize that, hey, you were burnt out?
Kevin, I didn't know I was burned out. And I've been listening to your podcast, and that seems to be not an uncommon phenomenon, that we're working so hard. We think that the solution when we're tired is to work harder, right? Because there's obviously something wrong with me. So if I just work harder, it'll fix it. And we get ourselves into this spiral. We're not aware. And a lot of times our colleagues, they're struggling too, so they don't know to help us, you know? And so I did not know I was burned out until one day I could not get out of bed. I was that exhausted. I happened to be doing call work in addition to my clinic work at my last assignment. And as a med-peds doctor, I was taking all the inpatient call, all the pediatric call, all the newborn nursery call for both services. I was doing the work for 2 people every month. And I just didn't know. I didn't know until it was over. Until I was crying in the staff bathroom every day, until I had chest pain and headaches every day as a previously healthy person. I didn't know.
And when you were making that transition and cut back on your clinical work, you said that you found yourself. What are some of the things that you specifically did to come to that sense of enlightenment?
I did a lot of inner work. I read a lot of personal development books. I literally, because I remember when I was burning out from doing too much call, my medical director told me, he was like, real doctors do call. And that hurt because we're real doctors. We don't come to work to fail, Kevin. We just don't. So I had to really work on my thoughts. And so, you know, just a lot of personal development stuff and prayer. That's what I needed to do. And it took me 10 years. It took me 10 years. And so that's part of my mission. I don't want other burned out people to take 10 years to get themselves reconnected with who they are.
All right, let's transition now to the Kevin MD article where you'll be talking more about that. It's titled, Amid Powerlessness, Reclaim Your Personal Power. Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
The reason that I wrote it was specifically because what I shared with you, that here are these fabulous people, physicians, clinicians, are fabulous people, but they save lives, right? We save lives. We're doing amazing things. We did amazing things to get here. But when it comes to making changes in our stressful work, if we're stressed out, if we're burning out, our courage evaporates. And it was illogical. We have these powerful people doing amazing things every single freaking day. But when you say, hey, why don't you make a change in your work? Take one less patient a day so that you have more time to go to the bathroom. I can't do that. I'm too scared. What if my admin fires me? What if I'm labeled a troublemaker? What if I don't meet my overhead? So that incongruence between the structural powerlessness that physicians and clinicians feel every day doesn't jive with the personal power that each of us carries. So in the article, I talk about a physician that I covered who literally had been telling her admin for years and years that she was overbooked, overstressed. Great doc, fantastic doc. No response, no responsiveness. About 2 years in, after letting them know what was needed, she put her purse on her shoulder and walked out. Drastic? Yes. But it's an example of personal power that she exercised. And personal power requires 3 things. The article talks about reclaiming your personal power, rediscovering that amazing person that was on your medical school or other program application, right? We did all these things, rediscover that person by asking yourself questions, okay? Get clear on what you want for your work. What do you want? And then create a plan, make a decision, and then make a plan for your work. You can do it. We have all the arsenal, right? We're leaders. We know how to create something out of nothing. Why can't we do that for ourselves? So that article talks about that. One thing I did not put in the article that I wish I had was remembering. So you're reconnecting, but really sit down and remember all that you've done. You can use that.
I think that scenario that you described really describes millions of physicians across the country about the burdens that administration places on them, that they have to see more patients, that we have to do this despite the support staff being short-staffed, especially during the pandemic. So can you apply some of your thoughts into a real-life situation? What do you advise physicians to do, short of just putting their purse on their shoulder and walking out? What are some things that they could do perhaps before then to reclaim some of their personal power?
Absolutely. So again, the first step is remembering and in realizing assessment. We don't do assessment well. Remember, we talked about a lot of doctors don't even know they're burned out. So you've got to know where you are with your work. First step. So there's a bunch of assessment tools on the internet. I have my own tool that I developed so that you can see how your job is affecting you and where you are. Where are you? Honestly, because if you're stressed out and burning out, you only have a certain amount of time before things continue to get worse and worse and worse. And if you change nothing at year 3, you're going to be worse off than you were. So first part is assessment. If you can't see yourself, ask a peer, how do you think I'm doing? Simple stuff. How do you think I'm doing? I can't see myself. How do you think I'm doing? Mistakes, errors, omissions, huge clue. I made them. I made things that fortunately never harmed a patient, but it was like, I did that. Look at your notes. The quality of your notes does this, right? So get the objective measurement. I also teach something called the SOAP method, SOAP. Use SOAP on yourself. Take 30 minutes, just like you would take 30 minutes for a special patient, right? You book that time for a complicated patient. Use SOAP on yourself. Subjective, how are you feeling? Objective, look in the mirror. What do you see? You know how to examine people. Is your hair falling out, your shoulders slumped, sad expression cast on your face? Assessment. Where are you? How are you doing? And then plan, do one thing. So that's something that can help. Assessment is huge. And then getting help.
So you make that assessment, and let's say that physician determines that he or she is burnt out.
Yep.
What's the next step after that?
The next step after that is to get help. Again, some of us know that what we want to do. Some of us know that we wanted to start something different or have a different clinical practice environment yesterday. But that's not my experience with most of the doctors that I've associated with over the last 13 years and covered for when they were sick or too stressed to work. There's a lot of lack of clarity. And again, I have been coached. I believe in coaching. It's a wonderful way to gather yourself and to make incremental changes and to get the courage to make those changes. Because a lot of people don't even know what they want. A lot of people don't even know what they need. They're too tired. They're too stressed out. Sometimes they need a break before they get a coach. So having someone come alongside you is critical. And I don't think I would have burned out as badly if I'd had someone in my corner, an ally. We don't share, Kevin. We're siloed. Some offices are literally structured so that you have one provider per pod. I covered for a practice, the providers were all together, they were happy, but they didn't like the fact that we were laughing and having a good time. They moved us to a building that every doctor had his or her own silo. Morale plummeted. So I hope I'm answering your question. It's these little things, the little things. It's far beyond, well, do this with your schedule, do that with your schedule. It is clarity before planning and understanding what you need.
One of the things that you said earlier really struck me when you talked about an administrator who said real doctors take a call. And that certainly can be extrapolated to real doctors see 30 patients a day. Real doctors work full time. Real doctors don't take days off. Now, how do you coach physicians to fight against that guilt the administration places on them?
Yes, we battle so much. We're not only battling, the barriers to change, right? We've got the financial things, right? We've got debt. We've got financial responsibilities. How am I ever going to get out of this? We've got all these things. And then we have the mindset. We have the institutionalized conditioning that we go through, both at our work level, but also during our training, right? We put on that white coat, fake it till you make it. You have a persona that you entered into before you're able to get mastery. So you grow up saying, okay, I am this. And so years later, when you're out in the workforce, they say you are this, and there's an incongruence because you can't be that anymore. It's very difficult. So what I do is I talk to physicians about, when we talk about power, we talk about themselves. What you deserve is a very good logical place, right? Because we fight logicalness, if that's a word, with truth. We fight it with truth. And the truth is that you are a healthcare expert. You deserve healthy work. We've got to start with that foundation. If we don't start with that foundation, we can't battle that. And then I talk about saboteur thinking. I talk about sage perspective, a learner perspective versus a judge perspective. So there are those voices in our heads, right? Who do you think you are? Throwing away your training. Those aren't our voices. So recognizing that there are these voices that are not for our best good is a very good way to start that foundation, to lay that foundation. You are worth X. What are you worth? Once you build that and realize that these are external voices to you, they sound like you, they're not you, then you can build.
Now, when you coach physicians to change their mindset, how difficult is that for some physicians?
Extremely, extremely. But the good news, the excellent news is that healthcare workers, clinicians, physicians, we're brilliant people. And so once you insert that nugget of truth, that process of inquiry starts. And that little kernel can't be taken away. And it can grow. And that's why peer coaching has been so effective, right? So you'll see these programs, right, at Mayo and Stanford, they have peer coaching. You're creating a normalcy, you're normalizing things. You can't get your footing when you're caught up in all that institutionalized thinking. You have to be around people who will resonate that truth, that you are worth X. You know what I mean?
We're talking to Cathy Woodhouse. She's an internal medicine pediatrics physician, and she wrote the Kevin MD article, Amid Powerlessness, Reclaim Your Personal Power. Cathy, what are some of your take-home messages that you want to leave with the Kevin MD audience?
Absolutely. Do something. If you are stressed out and you are burning out, do something. Get clarity, get power. If you need help doing that, get help, get support. Don't walk through this alone. You don't have to walk through this alone, but no one's coming to rescue you. And I don't mean to blame the victim, because I'm not trying to do that. But the reality is, if you do nothing, things are going to get worse. Do something, one small thing today in the direction of healthy work, whatever that looks like for you. It doesn't necessarily mean leaving medicine. Just one thing. What can you do? Can you pick up the phone and call someone for an appointment or to talk? You know, can you take one patient off of your schedule and pee and eat? One thing.
Cathy, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you, Kevin.